We're now going to perform the physical assessment. I washed my hands and provided privacy for the client. Hi, my name is Kellen. I'm going to be taking care of you today. What is your name?
Camden Eckern.
It's nice to meet you, Camden. Today we will be doing the physical assessment. So it'll be a full head-to-toe assessment. It's going to take about 45 minutes to an hour. Would you like to empty your bladder before we start?
I'm good.
Okay, sounds good to me. So first we'll just start with his general appearance. Patient appears to be clean with good hygiene. He is in appropriate attire for the situation and appears appropriate for the situation. Patient's behavior, he appears calm and making good eye contact, and appearance or behavior appears appropriate for the situation. Next, we'll look in patient's body structure. The patient is sitting upright with good posture. He extremities and body appear symmetrical, and I'm not noticing any cuts, lesions on the body at this point. I would next assess mobility. I watched the patient walk into the room. He had a smooth and steady gait with ease of extremities, and I did not notice any issues with balance or coordination. Next, I'm going to go ahead and ask you a few questions here, okay? Can you tell me your first and last name?
Camden Eckern.
And where are we right now?
Doctor's office.
And what month is it?
April.
Of what year?
2025.
Patient is alert, his eyes are open, and patient is alert and ordered to person, place, and time as well. He's A&O times 4. Speech is clear and precise. If you saw a house on fire, what would you do?
Call the fire department.
Patient's judgment is intact. Next, I would go ahead and assess vital signs. So I would assess the patient's temperature, heart rate, respiratory rate, and blood pressure. Following assessing the patient's vitals, I then go ahead and inspect the patient's face and head here. So looking at the patient's face, he appears tan. Color is evenly distributed throughout the body or through the face. I'm not seeing any cuts or lesions. His face appears symmetrical. Looking at the head as well, the head appears symmetrical. I'm not seeing any cuts or lesions on the head as well, and appears intact. Next, I'll go ahead and check out the skull. The skull again appears intact and it's rounded. I will then go ahead and palpate your scalp and look at your hair here. Looking at the patient's scalp appears clean. It's not dry or flaky. I'm not seeing any infestations in the scalp, any scars or cuts, lesions, or contusions on the scalp. The patient's hair appears clean. It is shiny and brown, and it is fully distributed evenly throughout the head. Following inspection of the scalp and hair, I'm now going to go ahead and look at your eyes here. So just looking at the eyes, I'm not seeing any discharge, any discoloration or edema. I'm not seeing any hemorrhages or bleeding in the eyes as well. I'll have you close your eyes for me here. Looking at the eyelid appears smooth. It fully covers the eye. The eyelashes appear clean. They are curved, moving outwards from the eye, and they appear evenly distributed. I'll have you open your eyes for me. Assessing the sclera here. The sclera appears white and moist. I'm just going to come and look below your eyes here. And looking below the eyes, the conjunctiva appears clear and moist. Next, I'm going to go ahead and assess your vision here. So what I'll do is I'm going to give you this card. It's called the Rosenbaum test. We'll have you hold the card about 12 to 14 inches from your eyes and cover one eye for me and read the lowest line that you can.
426739.
Patient's vision is 20/20 in the left eye. I'll then have you close your other eye, and then we'll test both eyes.
426739.
Patient's vision is 20/20 in the right eye, and now we'll go ahead and test both eyes.
426739.
Patient's vision is 20/20 in both eyes. Next, go ahead and look at your pupil size here. So looking at your pupils, the pupils appear to be 4 millimeters, and they are round. Next, I'm going to go ahead and look in your eyes here for a direct and consensual response to light. So I'll have you just look straight ahead for me here. And first I'm going to look in your left eye. Left eye was reactive as well as the right. We'll go ahead and look in your right eye. Right eye was reactive as well as the left. Both pupils are round and reactive to light. Next, we'll go ahead and assess accommodation here. So what I'll have you do is I'll have you look at my finger and then look at the wall. And then look at my finger and then look at the wall. Pupils constricted, accommodation is intact, patient has pearl up. Next, I'm going to go ahead and look in your eyes here. I'm going to use my ophthalmoscope and we will test for the red reflex. So what I will have you do here is I'll have you just look straight ahead for me. I'm going to look in the left eye, so I'm going to hold the ophthalmoscope with my left hand and look through my left eye. And the red reflex is present. I'll go ahead and look in your right eye here. So I'm going to hold it in my right hand and look through my right eye here. And the red reflex is present as well. That's great. After assessing eyes, we will now go ahead and take a look at your nose here. So first, I'm just going to look for nasal symmetry. The nose appears midline and symmetrical. Again, I'm not seeing any cuts or abnormalities with skin color, and the nose appears intact. I'll next go ahead and test nasal patency. So what I'll have you do is I'll have you cover one nostril and breathe in for me. Good. And I'll have you cover your other nostril and breathe in. Both nares appear patent. Next, I will go ahead and use my light here. I'm going to go ahead and just look in your eyes, or in your nose. So what I'll do is I will just have you tilt your head back a little bit here. So looking in the patient's nose, I see the patient's mucosa, the septum, and the turbinates. The mucosa appears moist and dark pink, as well as the turbinates, and the septum and turbinates appear intact. We'll go ahead and look in your other one here. Again, I'm seeing the mucosa, turbinates, and septum, and it appears intact as well. And nasal hairs appear to be evenly distributed throughout the nose. After assessing your nose here, now I'm going to go ahead and test your sinuses. So I will test your frontal, so I'll be palpating a little bit above your eyebrows, and then I'll test your maxillary, so kind of on your cheekbones below your eyes. Let me know if you have any tenderness here. Any tenderness?
No.
Okay, no tenderness noted in the frontal or maxillary sinuses. I'll now go ahead and move to your ear here. So what I'll do is I'm going to palpate your ear in a couple different spots and just let me know if you have any tenderness, okay? All right, so I'm palpating the pinna, going down and palpating the tragus, and I'll palpate the mastoid as well. Are you noticing any tenderness here?
No.
No tenderness noted when palpating the ear. The ears appear symmetrical. I'm not seeing any cuts or lesions or deformities of the ears. Now I'm going to go ahead and look inside your ear here. So I'll use my otoscope to look in your ear. So what I'll have you do, I'm going to assess your left ear first. I'll just have you turn to the left a little bit for me. I'm going to pull the auricle up and back. I'm going to remain in contact with the head. I'll tilt my otoscope towards the nose and just kind of look in your ear canal here. So looking in the ear, I can see the tympanic membrane. It is pearly white to gray. I can see the cone of light and a moderate amount of serum in the ear. Go ahead and assess your other ear here. So again, I will pull the auricle up and back. I will tilt my otoscope towards the nose, and I'm remaining in contact with the head. I'm going to look in the ear, and again, I see the tympanic membrane. That's pearly gray, the cone of light, and a moderate amount of serum in the ear here. After assessment of your inner ear, we're now going to go ahead and perform the whisper test. So what I'll have you do is I'll have you cover one ear for me, I'm going to whisper 3 words and then repeat those words back to me, okay? Chair, baseball, cat.
Chair, baseball, cat.
Whisper test intact in the left ear. We'll now go ahead and test your right ear. Football, chicken, sheep.
Football, chicken, sheep.
Football, chicken, sheep. Whisper test is a pass. Next, we will go ahead after the ears, and I'm going to look at your mouth here. So first, I'm just looking at your lips. Your lips don't appear to be dry or cracked. I'm not seeing any cuts on the lips. Can you go ahead and smile for me? Looking at the patient's teeth, I'm not noticing any missing teeth. The lips appear symmetrical, and the teeth appear white. I'm going to go ahead and now use my light and my tongue depressor. Just go ahead and look in your mouth here, okay? Looking in the mouth, I can see the posterior pharynx is glistening. Can you say ah for me? I see the uvula move up. I'm seeing the soft and hard palate. They appear to be intact. Looking at the mucosa, it is moist and pink. The gums appear to be intact. I'm not seeing any cuts or receding gum lines. Looking at the teeth, again, I'm not seeing any infections or missing teeth. And then looking at the tongue here, you can go ahead and just stick your tongue out for me. Looking at the tongue, it appears symmetrical, pink, and a little rough. That's great. After assessing mouth, I'm now going to go ahead and assess your neck here, okay? So what I'm going to do first is I'm going to assess your trachea for any tracheal deviation. So what I'll have you do is just kind of tilt your head up a little bit. I'm just going to palpate around your trachea. The trachea appears smooth and midline. I'm not noticing any tracheal deviation. That's great. Now I'll go ahead and I'm going to assess your thyroid here. So I'll have you keep your thyroid or your neck kind of in line here. Great. And then what I'll have you do is swallow some water, and I will have you just kind of, you can go ahead and swallow. Okay, so what I'm going to have you do is drink some water, and while you're swallowing, I'm going to palpate your thyroid. So I have you just tilt your chin up a little bit for me here, and go ahead and swallow. I could feel I could palpate the thyroid upon swallowing. The thyroid moved up a little bit. I did not notice any enlarged thyroid, any masses, nodules on the thyroid. Next, I'm going to go ahead and assess your pulses here. So I'm going to assess both carotid pulses. So first, I will assess your left carotid pulse. And it's about a 2+ amplitude with a regular rate and rhythm. And now we'll go ahead and assess your left carotid pulse here. And it's about a 2+ amplitude with a regular rate and rhythm. Now I'm going to use my stethoscope here, and what I'll do is I'm going to listen with the Bella's stethoscope to your carotid pulses to see if I hear any bruise, okay? No bruise noted in the left carotid. And no bruise are noted in the right carotid. That's great. After assessing your carotids here, I'm now going to assess your lymph nodes, okay? So what I'm going to do is I'm going to palpate multiple lymph nodes in your face, kind of on your neck, and then we'll go ahead and assess your arms as well. Just let me know if you have any tenderness here, okay? Alrighty. So I'm going to assess your preauricular, your postauricular, your occipital, your tonsillar, your submandibular, and your submental. And then I'm going to go ahead and assess your superficial cervical, your post-cervical, your deep cervical, and your supraclavicular, and then your infraclavicular. Did you notice any pain or tenderness there?
No.
And no lymph nodes were palpable. Next, we'll go ahead and assess the lymph nodes in your arms here. So I have you hold this arm up for me here. We'll assess this left arm first. So I'm going to assess your central, your lateral, your pectoral, and your subscapular. Any pain or tenderness there?
No.
No pain or tenderness noted, and no lymph nodes were palpable in that arm. Again, we're going to assess your central, your lateral, your pectoral, and your subscapular. Any pain or tenderness noted in that?
No.
and no lymph nodes were palpable in the right arm. That's great. Next, we will go ahead and move on to your upper extremities here, okay? So first, I'm just going to kind of inspect your arms. I'm noticing hair is evenly distributed throughout the arms. The arms are tan and color is consistent with the rest of the body. I'm just going to assess for temperature here. Arms appear warm and the warmth is evenly distributed throughout the arms. I'm going to palpate here. Noticing any pain while I'm palpating?
No.
No, I'm not feeling any edema in the arms. As well, I'm not seeing any cuts, bruises, masses, lesions, any abnormalities in the arms here. Next, I'm going to go ahead and I'm going to palpate your brachial pulses here, okay? So I'm going to palpate these at the same time. Just relax your arms for me here. And the brachial pulses appear to be about a 2+ amplitude with a regular rate and rhythm bilaterally. Next, I'll go ahead and I'm going to assess your radial pulses, okay? And radial pulses, again, appear to be about a 2+ in amplitude with a regular rate and rhythm. Next, I'm just going to take a peek at your hands here. So looking at the hands, I'm not seeing any cuts or clubbing in the fingers. I'm not noting any cyanosis or tenting. I'm going to go ahead and check your cap refill here. So I'll check cap refill in all of the fingers. Cap refill is roughly less than 2 seconds in all fingers. And then kind of looking at the nail beds, the nails appear clean and smooth, and the nail angle is roughly 160 degrees. Awesome. We're now going to go ahead and assess your posterior. So I'm going to look at your back here. Due to kind of the enlargement of the bed we have here, I'm just going to ask you to sit in this stool for me, please. So I'm going to swing over. If you don't mind just taking a seat. And so I am just going to kind of pull your shirt up here a little bit. You can take that. That's fine. Yeah, that's perfect. And so first I'm just going to kind of inspect the back. Just looking at the back here, I'm not noticing any abnormal hair growth. The skin is tan and appears to be consistent with the rest of the body. Feeling for warmth here, the back is warm and the warmth is evenly distributed throughout the back. Palpating the back here, I'm not feeling any masses. I'm not seeing any cuts or lesions or abnormalities on the back as well. Did you have any pain or tenderness when palpating the back there?
No.
No pain or tenderness. I'm next going to assess the spine here. So I'm just going to be kind of palpating down your spine. I'm assessing the spinous process as well as the paravertebral muscles. The spinous process and paravertebral muscles appear to be aligned and intact. I'm not noticing any abnormalities there. Also looking at the back appears to be symmetrical with an AP diameter of roughly 1 to 2. I'm now going to just place my hand on your back here. I'll have you breathe in and we will check for thoracic expansion. So I will have you just take a big breath in for me. Good, and out. Thoracic expansion appears to be symmetrical. Great. Next, what we're going to do is I'm going to percuss the back here. So I'm going to percuss the back in 10 spots in all lobes, the upper, middle, and lower lobes. So what I'll do here is I'm going to just place my finger on your back here and then just slightly percuss, okay? All right. Percussion resonance was heard in all spots in all lobes. Following percussion, I'm now going to use my stethoscope and I'm going to listen to lung sounds in all those same 10 areas in all lobes. And I will assess them bilaterally here. So I'll have you take a big breath in with your mouth here and out. I'll have you take a big breath in with your mouth and out. And again. Another big breath with your mouth and out. Couple more for me with your mouth here. And 2 more. Lung sounds were clear. I did not hear any adventitious lung sounds. Next, and we're going to assess for CVA tenderness here. So what I'm going to do here is I'm just going to place my hand on your back and lightly strike my back, and you let me know your back, and let me know if you have any tenderness, okay?
Great.
Alrighty. Any tenderness?
Nope.
Any tenderness?
Nope.
I'll roll your shirt back down here. No tenderness, CVA tenderness is noted, and I'll let you get back on the bed for me, please.